Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, which led me to co-found SPT with Me, which is an online NPTE study platform. If you feel like you enjoyed this video, feel like it was beneficial, please check out our courses at sptwithme.com for our full NPTE studying experience. Now onto what you're actually here for, let's talk about class levers. This is a picture that I'm sure you're all very familiar with when you learn about the topic of lever systems. And when you actually look into it, it's kind of interesting. If you try to find more examples online, oddly enough, it always seems to be the same three examples that you see present on this slide. So there are three classes of levers. They all include the same three components, the load, the fulcrum, and the effort. However, the difference between each of them is where each one of these three is oriented from each other. So look at the fulcrum in each of them. You're going to see if it's between the effort and the load. Is it the furthest away from the load? Is it furthest from the lever? And so forth. So let's talk about what each component means. So the fulcrum, it's the green triangle in this image. Think about this as the part that bends. Think about it as the pivot or the joint. The load, this is the blue arrow. Think about this as the location of where the effect of gravity is going to make as the joint or fulcrum moves. And lastly, the effort. This is the red one. So think about this as the muscle, or at least the muscle group, that is going to resist the effect of gravity or the load, thus controlling the joint from falling in the direction of gravity or the load. Now let's talk about each class, starting off with class 1, so the very top one. So you can see the fulcrum is between the effort and the load, and it really truly acts like a seesaw. So with the example that's used, the fulcrum, aka the joint, is at one point along the cervical spine. But to keep it simple, just know it's a cervical spine. So the load, again, is gravity's effect on the fulcrum. In the picture shown, the load is making the head flex forward. So as an example, think about, when you're getting really tired following lunch and now you're on campus for the second 3-hour lecture that you have. So, you start to close your eyes and you end up dozing off. So your cervical spine is going to flex forward. However, you don't want to be embarrassing or rude, so you quickly extend your cervical spine to look up at your professor in hopes that, he or she didn't see that had happened. So let's now talk about the effort. In this situation, your capital and cervical spine extensor muscles are the ones that counteracted you flexing your head forward, counteracted that load. It's just like a seesaw. So same thing can be said if, you switched where the effort and the load is. So just the opposite. Let's say you're watching a movie and your head starts to lean back because the movie is just that boring. Now the load would be coming from behind the person's head, while the effort, the muscles to bring your cervical spine back to neutral from this position would be coming from the anterior aspect of the cervical spine. So you think about muscles like the longus capitis, the longus colli. Now let's go on to the next class. So class 2 lever system. Look at where the fulcrum is, where it's in relation to the effort, the load. So the load is now in the middle versus the fulcrum in the first example, class 1. But now in class 2, load is in the middle, and the effort is the furthest away from the fulcrum. So let's look at the example of what's here, plantar flexion. So first thing is, where is the pivot point? It's easy to, immediately think that it's the talocrural joint. However, no. If you're doing a heel raise, where is this axis of rotation? It's actually at the metatarsal phalangeal joint. You think about the big ball of your foot. So this joint is the fulcrum. Now, next, the load. So try for yourself. If you're in a standing position, you stand in an optimal posture, do you feel how your weight is distributed on your feet? It's ideally 50% on the heel, 50% on the forefoot. If it's this case, that means the load is smack dab in the middle of the foot. So think about where your arch is. So now next, let's talk about the effort. The effort is the muscle, again, or muscle group that counteracts the effect of the load. So look at the location of the gastroc muscle relative to the load. Now what about its relation to the fulcrum? Well, this is the setup of a class 2 lever system. Class 3 lever system. Where is the fulcrum, aka the joint? It's at the elbow, the humeral ulnar joint. Where's the load? It's the weight of the person's hand. It's the weight of the object that they're holding, if anything. Now the effort. Again, the effort is a muscle or a muscle group. In this case, it's the biceps muscle. You're doing a curl, so you'll be using your elbow flexors. The effort then is between the fulcrum and the load. Now, like I said before, if you're doing an internet search to learn a little bit more about this topic, you're going to notice the same 3 examples of these 3 are given over and over and over again. The cervical spine, plantar flexors, biceps. However, if you're on a test, what would happen if you were given a different joint or a different region of the body? How are you going to figure out which class it is? My answer is that honestly, the only way that you can really get this down is if you know your anatomy. Of course, I'm going to give you an example about what we're talking about. So let's do an example of the hamstrings at the level of the knee during an open chain movement. So let's go over the rationale, but I want you to get thinking and see if you can identify where each component of the lever is yourself, even without looking at this image. Think about where the fulcrum is. Where is it with respect to the load, the effort? So in this case, the fulcrum is going to be at the knee joint. The effort is going to be the hamstring muscle and where it attaches to the bone, and the load is going to be at the foot. So this is your answer. The fulcrum's the knee joint, hamstring's the effort, weight of the foot or ankle brace or whatever it is the load. Doesn't this system look exactly like a class 3 lever system? Plus, our hamstrings are practically kind of a reverse of our elbows. Maybe that would help you out. Now that we know a little bit more about the lever system and the different types, let's talk about application. So I'm going to give you an example that should encompass all of these bullet points. So just imagine that your patient is coming to you for right shoulder pain due to a work-related injury. So this person's job duties, they require heavy manual labor, picking up boxes, packages, etc. So it really could just be, a lot of different job duties. This person could be working in a grocery store, a restaurant, firefighters, longshoremen, just someone who has a lot of manual labor. So think about a person that you've encountered who would benefit from good body mechanics to reduce their potential of injury or even re-injury from performing their everyday jobs. Now this person is coming for right shoulder pain. So let's say that they work in a grocery store in this case. You're going to ask them to perform an activity or movement that elicits their pain, which in this case happens to be when they flex or raise their right arm above the height of their head to, let's say, restock some items at that level. This worker is really stretching to be able to reach that top level to place the item there. Well, we all know that keeping carried objects close to our chest and within our base of support is going to provide the most optimal mechanic. Yeah, that's great. But with this knowledge of lever systems, this can really prove to your patient why that is a fact. So with this person, after they show me what they normally do, I'm doing a movement analysis, and it's time to educate my patient about what I found and how to address it. This is what I'm going to say. I tell my patient to imagine that they're holding a gallon of milk just about at chest level, really close to them. So, right now it's kind of heavy, but not terribly. Now I'll tell them to imagine they're still holding this gallon of milk, but if they were to extend their arms in front, so you're straightening your elbows just like I am, however, it's still at the level of the chest, what are we doing here? We're lengthening the lever system. So your fulcrum is at the glenohumeral joint. The deltoid muscle is the effort, and the milk that you're holding, the gallon of milk, is the load. So this is a class 3 lever system, and it's always going to be a class 3 lever system, no matter how far you hold the load away from your body. So we don't expect to change that part. It's just human anatomy. But what we can do is use this knowledge about how to maximize our efforts through understanding the lever system. So as I continue to, straighten my elbow, lengthen the lever system, it is going to be so incredibly taxing as I continue on for my deltoid muscle, for that effort. So if I can educate them that, hey, this is a class 3 lever system. Obviously, are you really going to say class 3 lever system? No. But in the back of your head, this is something that you could think about. If I were to lessen the distance between the effort and the load, such as holding that gallon of milk, or something more relatable, holding that box that they have to lift really close to their body versus far away, then we're going to minimize further injuries, maximize body mechanics, and provide movement patterns that are going to optimize healing capacity. If they don't change the way that they're moving, they're just going to continue to aggravate their symptoms and never allow themselves to heal. Another application is posture, muscle length tension relationships. And levers, they all go together. So say that your patient comes to you with posterior cervical spine pain, and upon objective examination, you notice that there's significant forward head posture. Now, we all know that forward head posture is not good, but why? If you want patient compliance, you have to explain things to them. They need to understand, that way they'll follow through. They're like, oh, that makes sense. I really need to do something. I need to do my HEP. So what I like to tell patients is that if we have a good posture, this means that our muscles are at an optimal length. And with an optimal length, these muscles are able to contract with not only great force, but they can sustain themselves throughout the course of the day, so endurance. Now, if our muscles deviate from optimal length, such as being too long, as with the posterior cervical spine musculature, there's a lot of effort required to produce the same force, and the endurance is not as good. So we can't sustain it for as long because of that. So the example that I use again, what I gave earlier, is holding a gallon of milk really close to your chest. It's not too bad, but when I straighten my elbows farther away from me, it's going to make it really, really hard to hold. And this is because, again, I'm not only lengthening the lever arm, which is what we talked about in the previous slide, but I'm also creating a poor muscle length tension relationship, which is going to lead the muscle to be overused or overstrained. So this exact concept is what occurs in this case with the cervical spine extensor muscles. They're elongated with forward head posture, and they're constantly working harder than they would need to if they had been in a better alignment. So lengthening the back, optimal position here. So the muscles are constantly being worked, and of course your neck hurts. And another example. Another application would be to use the lever system to your advantage by purposely increasing the lever system to make an exercise harder. So it's not always bad to, lengthen the lever arm. It has to be with purpose though. So think about an exercise that you could give your patient to address, let's say, the scapular retractor muscles. So the muscles between the shoulder blades. Let's say we've taught our patient to do a standing row with a TheraBand. Look at the image to the left. Now, once someone has gotten good at these rows, how do you challenge them further? Some options could be, change the TheraBand resistance. Instead of a blue band, you make it a black band, or maybe you could double it up. Whatever you want. However, there are other ways. Let's say that you don't have another TheraBand. Let's say that they're already on that black band, the hardest band. So let's use what we know about levers to our advantage. So look at the starting position of these two different individuals on this screen. So the image on the left. Don't worry about the height of the anchor, the resistance of the band, it doesn't matter. So aside from that, they're the same. The arms are in front, parallel to the floor. And we're talking about the two different individuals just respectively on the left. Now, the second part of the exercise is what's different. So the individual on the left is doing a row. So as he flexes his elbow, as he pulls the band back, he's flexing his elbow. The individual on the right keeps the elbow straight as the TheraBand is pulled back. Both of these address the same thing. They're both going to address scapular retractor muscles. But the one on the right is the harder way, as we're increasing the distance between the effort, which is your scapular retractors, and the load, which is the resistance from the band. So the scapular retractor is the muscle, the load is the resistance from the band. If you're going to lengthen the distance between it, you're lengthening the lever arm. That's a way that you can make your exercises harder. So a few things to keep in mind as we wrap this up. In class 1, the fulcrum is always between the effort and the load. Class 2, the effort is always farther from the fulcrum than the load. And in class 3, the load is always farther from the fulcrum than the effort. Now there's a reason I mentioned this. If you look at the image examples, you should notice that they are always facing the right. It's like you're seeing the right side of a person. Well, what if we were to switch the image so that they're facing left? Well, here's an example of that. So now you're looking at your patient through their left side view. My question to you is there a difference between the lever class due to this switch? The answer is no. It's the same exact lever. The fulcrum is the same, the load is the same, and the muscle tendon insertion, the muscle, is in the same location. It does not matter. Here are the references. I hope you enjoyed this video. Feel free to check out sptwithme.com.